Welcome to another episode of the People Productivity Channel, where you are the product and a better you is a solution. A number of weeks back, I had on a fascinating guest, Dr. Scott Blaise, and we had a lot of really good views of that particular interview. It's on our channel. Take out the trash, reprogram your subconscious, and change your life. This was about dealing with subconscious memories and things that are really going on deep inside the mind that are controlling different behavior patterns that you have as an individual. And this is certainly a topic because if people can actually remove or change some of the things that are holding them back, then in fact, they could change their future. So we spoke at the time of bringing Dr. Blaise back on. He's a fascinating gentleman, not just a hypnotherapist, but as I found out today, chatting with him before the interview, also an expert in Ayurvedic medicine. So, Scott, why don't you introduce yourself or reintroduce yourself to our audience, because some of the viewers will not have seen the first episode.
Great. Thanks, Frank. It's a pleasure to be back here with you. I'm looking forward to this one. My name is Scott Blaise. I'm a clinical hypnotherapist here in central New Jersey. I do have a health background of Ayurveda, personal training, which we spoke about is it's good for, helping clients with all facets of the life, obviously helping them with those repressed emotions and those bad memories and trying to overcome those bad habits. But obviously there's a reality part of it where, if someone wants to lose weight, we have to get them motivated, we have to get them up, and we have to physically get them into a gym or outside walking. There's obviously certain challenges that a lot of us face that need to be obviously attended to. So
Yeah. So what we're going to chat about today is really the practical side of this, things that you can do on your own. How could you use these tools and techniques to actually begin to maybe deal with things that you want to, like a phobia of spiders or something?
absolutely.
So, well, let's just get into it. In terms of the practical side of this,
Mhm.
why don't we just get right into it? Where do you think we should start?
Well, first of all, and I think we touched upon this last time. If we didn't, obviously this is a good place to do so. All hypnosis in and of itself is self-hypnosis.
Hmm.
You might go see a hypnotherapist or a practitioner. They may do certain steps and use certain modalities to help induce certain states of conscious, but it's up to the client, it's up to the patient in order to achieve those. So it's really a cooperative loop between, what is the client or patient exhibiting. The therapist takes that information, reiterates it, brings it back to them, and they're going to respond in a certain way. And if they're responding playing accordingly, then we go with that particular path. If not, we reiterate it, change it, and give it back to them in a way that they can understand it. So when looking at the more practical side and understanding that hypnosis is self-hypnosis, people can use certain tips and tricks, not even tricks, but just certain applications at home.
Hmm.
One of the more popular times, and we mentioned this before, is when looking at hypnosis, you can't enter sleep, meaning REM,
Yep.
without passing through a state of hypnosis. It's actually
Yeah.
called the hypnagogic state.
Hmm.
On the other side, when you're waking up, you can't wake up from REM sleep without passing through that similar state.
Yeah.
So a lot of times when people do these affirmations and they're going to do these things, they're going to do it at a time of day where they're dealing with a larger capacity of conscious functioning. Okay, example, middle of day, that part of the conscious, that part of the brain is very, very revved up. It's solving problems, it's dealing with challenges that you have in your life, it's dealing with the kids and the dog and work. But at night, when you're falling to sleep, that part of the brain, that activity shuts down. So
Yes.
my first suggestion would be this would be a great, great time if you need to help overcome a habit, if you need to learn something that's difficult for maybe school or work. That 15, 20 minutes before you fall asleep is a perfect time to do so.
Yeah, as the conscious mind is slowly shutting down, because we
Correct.
do pass through that theta state on the way to REM sleep, right?
Correct. Well, so normal consciousness is beta, then it goes into alpha.
Hmm.
Alpha, a lot of hypnosis can be done effectively in the alpha state. Obviously more deep-seated memories, more traumatic, very, very traumatic memories you would need to get into those theta levels, those deeper levels of mind. But if you want to overcome a bad habit, let's say you have a bad habit of you have 2 bowls of cereal before you sleep every night. That's not that's probably not coming from a traumatic experience. So just kind of quieting the mind and getting in that alpha state oftentimes is suitable enough to do that. And prior to bed and and waking up on the other side is a very, very effective time to do so.
Mm-hmm. I was watching some videos on YouTube. I always find this a fascinating topic and subject. And Richard Bandler, one of the co-inventors of NLP, he's helping an individual overcome and eliminate this bad memory.
Yeah.
And it turns out something happened where I guess there was some betrayal or something took place, and he keeps reliving this whole thing in his mind all the time. Yeah. Hours a day this goes on.
It was like 6 or 7 hours a day or something ridiculous.
And sometimes 6 or 7 hours a day. He's obsessed with this thing, and he keeps reliving it. And I guess he's trying to, ultimately deal with this pain that he's going through.
Yeah.
And he relives it. And anyway, he looks at the thing and says, over the next 10 years, you're going to spend X hours doing this. Would you like to have that time to do something else?
Correct.
And he has him actually look at this picture in his mind. He shrinks it down, right? 'Cause it's a big image. He shrinks it.
Yeah.
Then he has him go to the end of this memory, and has him go backwards through it with some music playing, and then he shrinks it down and blinks it off.
Is that the one with the circus music?
Yeah.
He's playing the circus
music playing. Fascinating. And, suddenly it's no longer a bad memory.
Correct.
And he's gotten all that time back, which is pretty fascinating because he's obviously obsessed with this thing.
Yeah, absolutely. There's a couple components going on here that need to happen in order for that to be successful.
Yeah. And what's that?
What Bandler is doing is actually he's working with something in NLP called submodalities.
Okay.
We experience external reality via the 5 senses, break that down into submodalities. Okay. So, if you go back and watch the video, one of the first things that Bandler's doing is he's doing the process of discovery. He's finding out information about this. One of the first things that he does, and he was very, very good at it, is to make sure that this is an actual problem, that it's causing this particular individual, challenges in everyday life. It's, if he's awake 8 hours a day and his mind is occupied by this traumatic memory, six of those 8 hours a day, how productive is this guy really being?
Yeah.
With work and relationships and stuff like that.
It's obviously debilitating.
Oh, I mean, I can't even imagine. All of us, and here's the thing, all of us are going to have bad memories and bad thoughts constantly throughout the day. But to have one and fixate on it for a lengthy period of time, it obviously becomes a challenge and needs to be addressed.
Yeah.
So, what he's doing in the beginning of the video, for those viewers who want to go Google it, he's making sure that it's painful, making sure it's a problem. That's why he's asking, well, how long? And then Bandler even kind of overdoes it a little bit. It's like, okay, and he starts doing the math, like you said. So over the next 10 years, that's X thousands of hours. So he's really, really hitting home to bring that pain forward.
Yeah.
Because when something gets painful enough, we will begin to seek some sort of alternative. That's why humans can live and function somewhat successfully with chronic pain and chronic illnesses, because it's not to the point where I got to get this fixed now. If you wake up in the morning and your mouth is throbbing from a toothache, you're probably going to go see a dentist that day.
That's right.
Right. So that's what he's doing. He's basically clarifying that that's the case. And then what he does is he works with those submodalities. So, are you seeing this image, or do you hear more auditory clues, or is it more a feeling in the body? So he's determining what is that main.
What was the main sense?
Correct. Right. Is he more visual? Correct. Is he more visual? Is he more auditory?
Yeah.
Or are there parts of both? So he establishes that. And once he does, and once Bandler gets this information, he kind of quiets the guy down a little bit because he was kind of a little goofy and funny. And, Bandler is kind of a character.
He's a character, yeah.
Yeah. And then what he does is have him close his eyes. And the gentleman tells him the picture's big. It's huge. It fills the room.
Yeah.
Is there color? Is it black and white? So he establishes this. So now he's bringing that painful experience up to the forefront. And like you mentioned, Frank, then all he does is he has him shrink it down to a size of a dot or a square. I think
Yeah.
it might be a dot. And then, like you said, okay, now you've got that, and and if you read the guy's body language and his facial expressions, there's obviously there was some sort of change going on. So
Yeah.
what he's doing is
Right away, you could see it.
right. He's changing the perspective of that bad memory, that traumatic experience. And then, like you said, he takes it a step further, and we see, and when we recall experiences, we recall them in pictures,
Uh-huh.
just like a movie. So you sit down and you watch a movie, and it'll appear fluid and continual, but they're frames that are looped together and played at a certain speed to make it appear as if it's a fluid experience and happening in space-time. But we think and we recall in terms of pictures. That's why this is so effective. So he has them call up that specific picture.
Yeah, it's fascinating.
Yep. Now what we're going to do is we're going to change the perspective of that picture. So in this particular instance, he has them shrink it down. Sometimes the picture will be small. I'll have them blow it up in certain cases. So some sort of visual change or auditory change needs to happen. And then he has him play the video backward. And now all of a sudden he adds in that audio component of that, the funny music, and it changes the whole memory.
Because it's that music of having things go fast.
Yes.
He says, rewind it quickly.
Yep. Absolutely. Absolutely. And
it's very fascinating.
And when you recall experience, the more modalities, the more of the senses you can bring to a picture, the more likelihood that we can change the perspective of that picture. Because oftentimes when we're thinking about one isolated incident, we're thinking of it in terms of visual. We forget the sounds or the temperature that day, or maybe it's, in the next room someone was cooking salmon and they had that certain smell. Yeah. But what we can do is we can either bring those back, bring those to the forefront, or even apply those like he did in that particular video, apply an auditory component. And it changes how you feel about it because you're changing the perspective of that particular memory or traumatic experience.
Yeah, it's fascinating because at the end, this guy is now free of obsessing about this.
Correct.
And in fact, he does get all this time back and suddenly he can change his future because he's not going to be spending time obsessing on this. I think there are many people who have things like this going on in their lives, memories that they might relive. It doesn't have to be to the level of being debilitating like that individual.
Absolutely. And so there's a third component there. So once that's established, and that's one of the reasons why I said, well, that's a lot of time. So if we get rid of this problem, we get rid of this challenge, you're going to have 6 hours a day, so to speak, to fill. Yeah. So the third component, what really makes it successful, what makes it more of a long-term solution is you have to fill that gap. So all we're doing is we're giving someone a choice, because we as humans, when presented with a choice, we're always going to make the best choice that we have with the resources available at that time. Huh? When people have a problem, especially a chronic problem or something like that, they feel helpless. They don't think that they have a choice. So holding on to that memory is a positive intent. So, but when we can change it and lessen it, either drain out color or add color or shrink it or, speed it up or whatever, and then reintroduce something that that person wants to achieve. So it's kind of twofold. Like, we have this bad memory on this side, but we want to replace it with the positive behavior or positive intent on this side, and it has to fill that space. It has to fit. It has to be congruent. Okay, example, you say, okay, I'm gonna quit smoking. And I'm gonna replace it with finding a cure to cancer. It's really not a congruent thing. I mean, it could potentially work, but it's probably not going to. It has to be of a similar nature.
So what could people do in terms of self-help for phobias, like fear of spiders and things like that, insects?
Yeah, so, there's a couple different things. And, I think it really centers around what I mentioned before is they need to utilize that 15, 20 minutes prior to sleep. Okay. And they can prepare for it. There's certain things that they can do. Nowadays with our phones and our cellular devices, we can pre-record a script. Sometime during the day or the day before, they can kind of write down their thoughts and organize what it is that they want to, you used before, download into that program, what application do you want to install? And then while they're sleeping, they can get in that relaxed position. And I'm going to make a couple recommendations here. Don't do it in bed.
Hmm.
Okay, you want to do it near bedtime, but you don't want to do it in bed, because what happens oftentimes, and happened with a lot of my clients, is they fall asleep prior to the program really being downloaded. Is it a bad thing? No. Okay. So, maybe like if you have a sitting room in your bedroom and you have a chair, maybe do it in the chair. If you have an office or a study, maybe do it in some chair that's comfortable,
Hmm.
some type of chair, or some place where you're going to sit where you're not going to potentially fall out of it, because sometimes that can happen. And really, that's one of the only really downsides of hypnosis is, the vessel has to be secure, because if people really go under deep, they could potentially roll off the chair and obviously fall down and hurt themselves.
Yeah.
So making sure the environment is controlled is tip number one. If
Hmm.
you have a dog, make sure he's not going to jump up in your lap during this, or, the kids are going to come in and ask about their math homework. So do it at a time where you can kind of control the environment best you can. And then they can simply play that recording. Okay, that's one way. They can just listen to that recording. It's almost like a mantra. It's almost like an affirmation, but they're doing it in a controlled environment, and they're doing it at a very, very good part of the day where they're going to be receptible to the information. And they can just do it, every night before bed, or maybe do it in the morning. And then what I also recommend is, while you're sleeping, the unconscious mind is going to work on that. It's going to go to work, and it's going to try to figure out the best possible solution, the easiest way to help overcome that. And sometimes information may come in the form of a dream. It may come in the form of a metaphor or something weird. So I usually recommend that upon waking, people have something that they can jot notes down on, whether it's their phone, whether it's a pad and pen near their bed.
Yep.
And whatever conscious thought they have when they wake, just write it down. Because as soon as you get up and you start your day, that's going to go by the wayside. It's going to go back.
You're going to forget it. Yeah.
It's going to go under the blanket, so to speak. So it's good to maybe deal with that information, and you can either look at it yourself, or you can involve a practitioner and have them kind of work through it a little bit.
Hmm.
They can also do, what Bandler was doing. They can, at that time, okay, same time at night, night, they can take that image. And the first step is you want to get a clear image of it. You want to see what it is, okay? Then change it somehow. Like Bandler, you can make it smaller. Think of the inside of your mind, the inside of your forehead, the inside of your forehead, like a movie screen.
Yeah.
You're sitting there. So now what you're doing by doing that is you're disassociating. You're seeing it from a third party perspective now, because if you imagine yourself sitting in a theater and you're looking with your eyes closed, and the inside of your forehead is that movie screen, you're going to see it from a third party perspective most often. That's one thing you want to determine. Are you recalling these memories from a third party or first party perspective? And sometimes changing just that simple perspective can have, profound positive changes.
Yeah.
And then they can just run through and have some fun with it. It's already happened in the past. You're already concerned about 6 hours a day. It's not going to hurt you anymore, most likely. Let's have some fun with it, Leo. Throw a cartoon character in there, do something funny, throw some auditory things in there,
Change the outcome.
Yeah, change the outcome. And the first thing you do may not work. That's okay. Next night or later on that week, try something else. And see what works best for you, because we're all individuals, and we're all going to respond differently to certain modalities and how they kind of play out. But yeah, they can have fun with that, because again, it's all hypnosis is self-hypnosis. And as you see, during that video, that person's awake. He's not really in a state of hypnosis.
No, not at all.
No. So, you don't even need to get to certain trance depth to affect change. It can be done in waking, waking consciousness.
I think the most important thing is that, for people who may have phobias, want to deal with stopping smoking, deal with weight problems, maybe deal with bad memories that they keep reliving, they don't have to accept those things, and they can change them. And I think that's the most important thing.
Yeah.
That they can change this, and they should be aware of that, right? Because they can have a different future, which I think is very important.
Yeah. And sometimes, in severe cases, there's going to be a physical manifestation component that needs to be addressed as well. People can get addicted to the manifestation of those memories. Or example, someone in your life is always hitting those buttons and always making you angry. If that's allowed to play out over years of time, they'll become addicted to the slew of chemicals that the body's producing when they're in that argument or they're in there at that fight. And consciously, they don't want it. But on that physiological level, the body has now become the mind, and it's taken over and say, "Ooh, I want more of that stuff. So let's go ahead and call Bob and start up another argument."
It's a bad habit.
That's when it's a really bad habit, and it definitely
it's a bad habit. Yeah, that's a habit. They've got to replace those habits. And I think the awareness that people can change these things, if they take anything away from this program, maybe they can't do it on their own, but they can change some of these things going on that really aren't positive aspects, in their life.
Well, that's why the third step of what Bandler was doing, excuse me, in that video, you have to replace it.
Yeah.
It has to be replaced with something positive, because number one, it sets it up as a choice, and hopefully they've come to the point where they're going to want to choose something.
Yeah.
If we think we have a choice, example, people will live in certain neighborhoods in certain conditions because they firmly believe that they don't have a choice. They can't live on the other side of the tracks. So what they do, they accept it and they deal with it, and it becomes chronic, and then it spills over into other aspects of their life. So presenting them with, example, if you want to give up smoking, that's why a lot of, surface smoking, cessation things will be, okay, we're going to chew gum.
Yeah.
Or, you need to have something
to replace the habit. Yeah.
Correct. So, if we want, if your weight loss is, a root cause is you're just eating too much, you're overeating, eating the bad foods, those bad foods need to be replaced with something else. Or the bad behavior needs to be replaced with a positive behavior. And once that's done, the likelihood of, number one, success, but number two, long-term success increases tenfold.
Yeah. And, a lot of people get the motivation to finally change things when something bad happens. Like they're smoking and they realize, oh, wow, there's a growth on my tongue. I've got to stop.
Correct.
That
relates to what Bandler was doing. He wanted to make sure that the memory that he was going to deal with in that example on that stage was going to be a powerful enough one to help overcome. I have bad memories. We all have bad memories, but is it going to work on a stage with maybe not, because it's not controlling my life. Yeah, I think about them. I'd like to not to think about them, but I'm not spending, sometimes I'll go 4 or 5 days and it won't pop up. But 6 hours a day, that's
a real problem.
Correct.
I mean, I think there are many people who, had instances in their life that, they keep reliving because maybe it did cause things to go awry for them. And thinking about how it could have been different or something. And, now they're just living in the past.
And oftentimes when people experience a bad memory, there's sometimes a guilt factor associated with it. I wish I could have done that, or maybe I should have done that. So is it really the bad memory, or is it the guilt of the bad memory?
That's a good question.
I had a client that I worked with, over several sessions, who had a fear of eating in public. She could not eat in public.
Really?
She couldn't eat in public. She would masticate her food till it was liquid in her mouth and then spit it out in her napkin. At home, fine, but in a public situation.
What was the root cause of that? What happened to her?
So her father had passed away several years before. While he was in the hospital prior to him passing, and she went to visit him one day. She was the only person there. And he was taking his medication as usual, and one pill might have been too big, and he started choking on it. And here's a young girl. So what does she do? Fight or flight kicks on, or fight or flight freeze in her particular situation. And she didn't know, do I help my dad? Do I go get help? Do I run? And she just stood there. And there was a guilt associated with that. So positive outcome didn't happen until we addressed that.
Oh, very interesting.
And now she can, go on dates. Now she can go, to public places and do all those certain things. And it's not affecting her, in a negative way.
That's fascinating. Yeah, there's something debilitating, right? Can't go out on a date because you can't eat in public. Wow.
And oftentimes with traumatic experiences like that, the conscious memory of it is actually not the root cause. It's something else. That's where, you mentioned before, getting into those lower levels of brain activity and really opening up that chest of memories and past experiences. And obviously hypnosis is a very, very good vehicle to be able to do that, to unearth those, what was the actual root cause. And oftentimes it's below, the person's conscious awareness. And if it's really traumatic, it's a defense mechanism of a human being to pack that away because they can't consciously sort it out.
Yeah.
Any experience we have that we can't consciously work out in our mind, we hand over to the unconscious mind.
Hmm.
If they can't deal with it, it gets shoved down even more. That if you want to even talk about past lives, information like that, past memories like that can be even passed on in certain situations like that. That's when you really need to get down there and to unearth it.
Yeah, this is an amazing topic because it covers so much territory.
Yeah,
People can improve themselves,
correct.
and there are a lot of things holding them back in
You know,
general.
I have a personal experience with this that I really haven't, had maybe the opportunity or maybe even courage to address. So, with my mother, she, when my grandmother was passing away, they had a couple situations that, right at the end of her life, they kind of stopped talking. They had
Uh-huh.
this big fight. I'm not going to get into it all here.
Yeah, yeah. Of
They
course.
stopped talking, and my mother found out secondhand that her mother had already passed away and was already buried and was not even at the funeral.
Oh my
Not
God.
even notified. She found out about it, I think, through a third party or in the paper. I don't remember exactly what I was. This was fairly recently, in the past several years. And I don't live near my parents, and I get to see them maybe once or twice a year for our typical holidays and things like that. And I do notice a difference in my mom. She does the same thing. She's going about the same routine. She does the same things, but she's different because I know that traumatic event, we don't talk about it. We're not dealing with it.
Mm-hmm.
Either she's packed it away, or like the gentleman, in the Bandler incident, she's going about her daily life, but in her mind, she's replaying, well, geez, what would happen if I would have went there? What happened if I did not do that?
Mm-hmm.
And it needs to be addressed. And most of, but here's the point. She needs to be ready to address it. I can't go to her and say, Mom, let's sit down on the couch and let's go ahead and deal with this hypnotically. It's not going to work. She
Yeah.
needs to want to affect the change. So, that's the first step is people want to have to change. They want to have the option of having that positive
Yeah.
choice.
And that is why Bandler talks to the guy about the amount of time he spent
Correct.
on this to drive the recognition that this is really debilitating and I need to do something.
Right. That was obviously during some type of talk or seminar. It was like a 6 or 7 minute clip. I'm wondering how many people he had up in the stage that he just called back. Like, not to get off subject, but when looking at stage hypnosis, most of those people aren't randomly selected. It doesn't work that way. They either pre-hypnotized them and selected them prior to the show and then brought them up, or it goes through a process of, okay, who's the most suggestible, bring that bum up on stage. And if they're not going to, quote unquote, go along with the show, he'll step back and keep the best subjects up there. Why? Because it's going to produce the best show, the best result. Same if that guy wasn't, well, I think about that F that I got in art class back when I was 17 about once every 3 months. Okay, that's not, you need to go back. I need somebody else.
Yeah, absolutely. So this is a great topic, and I thoroughly encourage people who may have things that they want to change. Could be obsessing over things, could be bad habits, could be actual addictions and things. They gotta, they should know that they can take care of this. Maybe not as easy, but there are things they can do.
Especially now with what's going on in the world today.
Yeah.
How is this affecting people? What memories are people going to, if and when this ends, what are they going to bring with them?
Yeah.
Each of us are going to fill our suitcase, so to speak, with different experiences during this time, and we're going to move forward in our lives separately with those individual suitcases. So what information, what experiences, what traumatic memories from this time are we going to be able to, are we not be able to, are we going to bring forward? And I think that, understanding this and having these little tips and tricks and applications that people can do, they're not hopeless. There is
not hopeless. I mean, they should look into it and see what their options are.
Right. I mean, during this time, I've been a little bit busier because of what's going on. I mean, I really haven't had the chance to sit down face to face with someone, but doing a lot of things, via Zoom and whatnot, and just talking to people. Sometimes I really don't like to do Skype. It's called Skype hypnosis. Use Zoom or Google Meet or whatever.
Not that effective.
Well, I mean, there's obviously safety concerns. There's obviously a little bit of lag. If I suggest something to a client, I want to see real time
Yeah.
how that's affecting them, especially if they're kind of, in a trance state.
Hmm.
Are their eyes rolling back in their head? So, example, with someone's eyes are closed, I can still see if the eye is moving underneath the lid. I can
Okay.
pay attention to breathing patterns. When they
Uh-huh.
first came in, were they breathing more from the chest to the stomach or the diaphragm? And how is that breathing pattern changed? So is
Yeah.
it breathing change? Is their skin more flush or did it drain of blood? I mean, all these things is very, very
They all
difficult.
matter. Yeah.
Correct, it all
Yeah.
matters.
Well, it looks like my dogs have become part of this episode. I can hear them barking up there. Somebody must have arrived.
That's why I said you got to control the dogs during the self-hypnosis.
Yeah, 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 for sure. Well, listen, I'd like to thank you for coming back on the channel. I think this was super.
Awesome.
Appreciate it. There is so much people can do because everybody can become a better version of themselves. There are all things out there that we can change, right?
Absolutely.
Hey, thanks for coming on, Scott.
Thanks for having me,
Really
Frank.
enjoyed having you. Take care.